Good afternoon. First, I would like to say thank you for this opportunity for sharing our results on estimating the number of people who inject drugs, PWID, in 2 urban areas in Mozambique using 4 different methods. PWID hierarchy population for HIV in Mozambique National Strategic Plan. No prior data on HIV prevalence or population size estimation among PWID in Mozambique. The national HIV prevalence is 11.5% in adults aged 15 to 49 years, and the model of transmission study suggests that 10% of HIV has the result of injection drug use. This is the first integrated biological and behavioral survey conducted in Mozambique in 2 urban areas, Maputo and Nampula, using respondent-driven sample, men and women were with 18 years old and lifetime injection drug use, lived, worked, or socialized in survey area were eligible to participate in the survey. The survey was implemented from October 2013 to March 2014. 351 PWID were recruited in Maputo and 139 in Nampula. Given the lack of standard method, we synthesized 4 methods to estimate the number of people who inject drugs in Mozambique. These methods include unique object multiplier, wisdom of the crowd, sequential sample, and literature review. For the unique object multiplier, we use 2 sources of data. Flashlight keychain were distributed to the people who inject drug in the community. In the IBBS survey, participants were asked if they receive the flashlight keychain. Using the total number of flashlight keychains distributed divided by the hardest adjusted proportion of survey participants having receiving a flashlight, we calculated the estimate for each site. For the wisdom of the crowd, in the IBBS survey, participants were asked to give their best guess on approximately how many people who inject drugs do you think live in or and around the city of Maputo or Nampula. We used the median of all respondents as the best estimate. For this method, participants who reported the same number for both personal network size. The question is how many people who inject drugs the potential participant know by name and who know his name as well. And the population size estimation, that the question is how many PWID do you think live in or around the city, were excluded from analysis due to the possible confusion between questions. For sequential sample, we did the simulation using respondent-driven sample analysis software. The general idea is that the higher degree nodes are more likely to be sampled first, and intuitively the change in the degree distribution of successive waves reflects the depletion of the population, and this can be quantified to estimate the population. The software used the worded sequence of self-reported participant network size, that is how many PWD the participant know by name and who know his name as well, to produce the size estimation of the population. For literature review, based on World Drug Report 2014, where the prevalence of people who inject drug among general population aged 15 to 64 years old is 0.7% for Africa, we apply this estimate to the 2014 Mozambique census projection to estimate the population of people who inject drugs in each city. Then we did a consensus meeting among stakeholders where agreed that the median of 4 estimates as the best estimate for each city. Also agree that the highest and the lowest estimate as acceptable bounds, and the lowest estimate for each seat is the high BBS sample size, where distributed 480 flashlight kitchen in Maputo and 447 in Nampula. In the high BBS survey, 19.8% in Maputo and 11.4% in Nampula receive the flashlight. The population based on unique object multiplier is the total number of flashlights distributed divided by the hardy SAT proportion of survey participants ever receiving the flashlight. Using this formula, the number of people who inject drug were estimated at 2,061 in Maputo and 3,921 in Nampula. The population based on wisdom of the crowd was 300 in Maputo and 7 in Nampula. This is the result of the IBBS survey median, value reported as the best guess when the participants were asked how other PWID do you think live in around each city. The population based on simulation of sequential sample was at 2,869 PWID in Maputo and 463 in Nampula. We can see in this graph the summary of the 4 estimated unique object, wisdom of the crowd, sequential sample, and the literature review. The bold number are the estimates, and the bar represent the plausibility bounds. The number of people who inject drugs in Maputo were estimated at 1,684 in Maputo, that represents 0.22% of adults. We can see in this gray box the range of the people who inject drugs in Maputo and the percent of the adults in Maputo too. For Nampula, the number of people who inject drugs were estimated at 520, that represents 0.15% of adults. And we can see in this gray box the range of the people who inject drugs in Nampula and the percent that represent of adults. During the EBBS, we had the opportunity to collect a blood sample for HIV testing, and the HIV prevalence was 36.8 in Nampula and 50.3 in Maputo. Applying the HIV prevalence to the population size estimate, there are 847 people who inject drugs infected with HIV in Maputo and 191 in Nampula. This result highlights the feasibility of using multiple methods to estimate the number of people who inject drugs in Mozambique. Given limited population size and higher rate of HIV infection, intervention has harm reduction, prevention, HIV care, and the treatment service could be practical and affordable in this population. You know that the estimation of key population size is essential for advocacy, program planning, and monitoring of HIV epidemic. I'd like to acknowledge the contribution of all institutions involved in the implementation of the survey, all survey participants, and the Mozambique IBBS Technical Working Group. Thank you.